Hi, I'm here in Madrid at the European Society of Cardiology meeting, having just presented the results of the REFINE ICD clinical trial. This is a large international multi-center study that looked at how best to treat patients after myocardial infarction. This study had two phases. The first was to test these patients with a Holter, a 24-hour ECG, to be able to detect risk markers in those patients. And then we looked at those patients with higher risk markers and randomized them to a defibrillator or standard of care. The first comparison was to look at those patients who had the risk markers versus those who did not. And in fact, the patients with the risk markers had about 2.5 times the risk of death. Among those patients who had the abnormal risk markers, we weekly randomized them to a defibrillator or standard of care, and surprisingly found that the defibrillator did not alter their long-term survival. Other important findings from this study were that the overall rate of death was actually quite low, even in the high-risk patients, being 10% at 4 years. And also that about half of the overall deaths were non-cardiac in nature. And this brings up a number of important things we need to follow up on in terms of how best to manage these patients and why the defibrillator wasn't effective in terms of reducing overall mortality.